There you will be looking to the records of the treating physician, that's the orthopedic surgeon, any consultants or other medical care providers. You will not be able to use affidavits or declarations to satisfy the requirements of this particular payment, this particular $75,000 base award. Base payments, probably what everybody's interested in hearing is, when will those payments be made? I could go through the 12 different provisions in the settlement agreement that add up to a particular payment date, but it is anticipated and it is accounted for in the MSA that these payments should begin in July of 2015 with the way things are set up. And I think that we're going to really try to push that particular date to make that a reality with the fact that during the walkaway period, the 90 days starting March 2 and going forward, when the defendants will be looking to determine whether or not they're going to exercise their walkaway right. During that period, the defendants will be paying. We will be up and running and processing claims as they come in, despite the fact the defendants will not have made the determination yet as to whether or not they're going to exercise their walkaway. So that when we get to the end of that walkaway period, we anticipate that a significant number, if not all, of the base payments have been administered and processed. So, what you need to know about that is get your base payment information in and your base, payment enrollment information in as close to March as you possibly can, so that we can guarantee that the vast majority or a significant portion of the base payments happen in July of 2015. I think Ben, if you're able to get on, I think you're going to talk about enhancements as it relates.
Yeah, I think I'm on now, Eric. Y'all hear me?
I can, yes.
Okay, good deal. We had a little technical difficulty also. Thank you, Eric. That was a really good overview. I'll talk just a little about the enhancements now and make some references to the pages for everyone who's listening. And everyone already said we'll take emails later and try to follow up with questions afterwards with emails or on the enhancement award schedule for the benefits available under the past matrix levels. That section starts at 7.2.1.4. which that's the award schedule, which is actually, if you go to the Master Settlement Agreement, starts on page 72. So there are various, like other settlements we've done, matrix levels 1 through 6. Level 1 is re-revisions and subcomponents of that, which I'll go through. Matrix level 2 are major complications with subcomponents we'll talk about briefly. Matrix level 3, myocardial infarction or heart attack. Level 4 is stroke. Level 5 is death. Level 6 is lost wages. And obviously, as the settlement points out, matrix level complications that occur, these are all for complications that occur prior to the enrollment date of March 2nd, 2015. There's a section on future enhancements, which I'll mention also. Going a little more detail, starting on page 72 of the matrix level benefits. Matrix level 1 is re-revision surgeries. For a base level enhancement re-revision, that's a $175,000 benefit, and there are additional benefits of $100,000 for each subsequent re-revision surgery for a maximum of 3 per hip. So, without getting into the details of that, which we can talk about at the meetings, there are additional benefits for subcomponents of re-revision surgery that include a controlled osteotomy, again, a maximum of, in this instance, 2 per hip. Those are $75,000. And intraoperative femur fracture with an osteotomy, $100,000 with a maximum of 2 per hip. And femur fractures without an osteotomy, that benefit is $40,000 with, again, a maximum of 2 per hip. And $75,000 is for a surgical repair of abductor muscle damage, and again, a maximum of 2 per hip. So that's matrix level 1. Matrix level 2 is for additional surgeries. This, looking at the MSA, it starts on page 75. It's 75 and 76. So there are various incremental amounts for these matrix level 2 benefits. $35,000 it begins with for any additional surgery to remove hardware that was implanted during an osteotomy or repair of an intraoperative femur fracture, a maximum of 2 per hip for those. $70,000 per additional debridement surgeries or surgeries to remove a pseudotumor, again a max of 2 per hip. $100,000 benefit for any additional surgeries to reattach or repair damaged abductor muscles, and that's, again, a maximum of 2 per hip. And there's a $50,000 benefit for additional surgeries to replace a constrained liner, constrained component or liner due to a dislocation, and that's a maximum of 2 per hip. And a $100,000 benefit for each additional surgery to repair a femur fracture that occurred within 90 days of a qualified revision surgery or re-revision surgery. And again, that benefit is a maximum pay of 2 per hip. Limitations on these, these are where reductions, as Eric mentioned, come into play. A 10% reduction for a BMI of greater than 40, a 15% reduction for a BMI of greater than 50. In addition, claimants shall receive only one additional surgery enhancement, the greater of which applies per Matrix Level 2 benefit. Matrix Level 2 also has a dislocation benefit. This is on page 76 and 77. These dislocation enhancement benefits have a tiered payout also. There's $25,000 per closed reduction. There's $60,000 for a dislocation that results in an open surgical reduction. There's $75,000 per dislocation in an open reduction with a conversion to a constrained liner because of a dislocation, where the surgeon goes in and puts in a constrained liner to try to keep the hip stable after abductor loss and that kind of thing. And note that there's, again, a 10% reduction for a BMI greater than 40 and a 15% reduction for a BMI greater than 50 at revision. And the first dislocation has to occur within 9 months of the qualified surgery or re-revision surgery. So again, this dislocation has to take place within that 9 months after the qualifying revision or re-revision surgery. And again, there's a maximum number of dislocation enhancements, which is 3 per hip, where the product has been removed from that hip where the revision took place or re-revision. The next section, the next subcategory in Matrix Level 2 is for infection benefits or infection enhancements. There's, again, a tiered approach here, $30,000 per infection that's managed in a debridement or irrigation surgery under general anesthesia. It goes up to $75,000 per 2-stage surgery under general anesthesia required for the removal of the head, shell, and or the liner on the acetabular side, of course. And the $10,000 per infection managed with IV antibiotic treatment lasting longer than 6 months. Finally, $50,000 per 60 days of confinement in a skilled nursing facility of up to 60 days. I note that an infection in the hip from the affected product must be diagnosed within 9 months of the revision surgery or covered re-revision surgery or additional surgery for debridement, etc. And treatment must begin within 90 days of the diagnosis of the infection. The maximum number of infection surgical enhancements will be 1 per surgery and 2 in total. An individual who qualifies for an infection enhancement under Matrix Level 1 and 2 will only receive 1, the greater of the 2 that applies. And the next subcategory is foot drop. Again, a lot of these parallel past settlements you're all familiar with, but for foot drop begins at $20,000 per foot drop that is documented as existing for greater than 90 days following a revision surgery or re-revision surgery. And compensation will be based on age and severity of the foot drop, documented as 365 after a revision surgery or re-revision surgery. Their categories are moderate and severe, and there's incremental amounts that are laid out in the enhancement guide. And I'm not going to read all of these off, but you can see the amounts there. Obviously, moderate is defined as meaning that a claimant experiences a gait alteration requiring crutches, etc. And a severe disability level or severe enhancement is for people with those that where the claimant requires a wheelchair for a substantial portion of daily activities or underwent an amputation as a result of the foot drop. Finally, on the last benefit under Matrix Level 2 are PEs, pulmonary emboli, and deep vein thrombosis. This is page 80 and 81. There's $20,000 for a deep vein thrombosis, $35,000 for a pulmonary embolism. There are criteria laid out on this page: diagnosis, a hospitalization for the qualified revision surgery or open surgical procedure, or within 72 hours of the qualified revision surgery or open procedure itself. The claimant is entitled to just 1 PE or DVT enhancement per qualified revision or open surgical procedure, and the maximum number of PE or DVT enhancements shall be 2, regardless of the number of covered surgeries. Next level is matrix level 3. This is for heart attack. This is page 81. The enhancement is based on a finding that the pre and post heart attack change in functional classification is defined by the New York Heart Association, and B, the claimant's age on the date of the myocardial infarction as follows. And the MSA lays out the class 1, class 2, and class 3 changes in terms of complication level and the various incremental amounts of age which are as the age of the claimant. MI must occur during hospitalization for the qualified revision surgery or open surgical procedure or within 72 hours of that procedure. Again, there's a 10% reduction for BMI greater than 40, a 15% reduction for a BMI greater than 50. And here's where the only place where smoking comes in. Obviously, Eric mentioned not for the base benefit, but for an MI, 5% reduction for current smoking at the time of the revision surgery. And the number of enhancements for MI will be 1. Stroke is similar. That's page 82, matrix level 4. Again, the same kind of criteria to establish a claimant's eligibility for the stroke benefit, and the age claimant again results in a tiered down level of compensation. Again, the eligible stroke must occur within 72 hours of the revision surgery or open surgical procedure, and again the same reductions apply. The next level is the death benefit. That's matrix level 5. This is on pages 3 and 84. There's a $100,000 death benefit per minor child, $25,000 per adult child, and $50,000 per parent. Lost income as applicable under state law to age 62, and the death must occur during the hospitalization for the revision surgery or the covered surgical procedure. It's not combinable with any enhancement for the same qualifying revision surgery or open surgical procedure, and again, the same reductions apply. The minimum recoverable for the death benefit is $100,000. The maximum death benefit is $600,000. The final matrix level is the matrix level 6 for lost wages. This is on pages 84 and 85. Claimants are eligible to receive up to $200,000 in lost wages as a result of a revision surgery or qualifying re-revision surgery. The threshold for this benefit is 20% of the claimant's aggregate income for the 2 years preceding his or her index surgery. And any amounts recoverable here will be set off by amounts received from Broadspire for lost wages. Finally, just a few words about the future matrix level benefits. They pattern the same categories, the same matrix levels 1 through 5 for re-revisions and major complications, etc. This is all covered on pages 85 through 89. And in a nutshell, it provides that a future matrix will compensate claimants who suffer post-matrix level complications after the enrollment date, so after March 2nd of 2015, and within 2 years of the qualified revision surgery or the last pre-enrollment covered open surgical procedure. There will be no reduction in benefits here for covered events that occur within 1 year of the enrollment date, but events that occur during the second year following the enrollment date will be subject to a 30% reduction. So with that sort of summary of the enhancement benefits, I'm going to turn it over to Genevieve and Ansley to talk about a couple of other issues.
Yeah, this is Ansley. I'm going to talk briefly about lien resolution, and then Genevieve is going to pick up and point out some facts that everyone needs to know about Broadspire. Under the settlement, the claimants will be responsible for all their liens, specifically all liens related to medical care associated with the revision. What we did is that we saw a need to assist in resolution of these liens, so the Settlement Oversight Committee has hired a lien resolution company called Provideo Meta Solutions, who is very conversant in being able to go out and resolve types of governmental liens that are involved here. And Provideo will resolve Medicaid, Medicare, VA, all type of governmental liens for everybody that's enrolled in the program as claimants. Most importantly, I think people will want to know about whether or not Provideo is going to be available to resolve the private health care liens. That is an option that will be available. people on the PLCC, including me, have